Now I would invite Professor Dr. PRAVEEN VASHIST, Head of the Department, Community Ophthalmology, RP Center, AIMS, to start the session. Sir is Chief Instructor for the session. Thank you. Over to you, sir.
Thank you, Sumit. A very good morning to all of you. In fact, we are thankful to All India Ophthalmic Society that they have given us opportunity to present about the latest indicators by WHO about effective cataract surgical and effective refractive coverage. And these are the indicators which are marked as the indicator for universal health coverage. And they are the global indicators, not only for specifically for India, that each and every country in the world they are supposed to maintain these indicators. I'm Professor Praveen Vashisht. I'm officer in charge of Community Ophthalmology RP Center. And along with the co-instructor for this course are Dr. Suraj Senjam, is our additional professor in Community Ophthalmology in RP Center. Dr. Vivek Gupta is also additional professor in Community Ophthalmology in RP Center. Dr. Nupur Parekh, she additional professor of ophthalmology in RP Center. And Dr. Sumit Grover is present here. He is research officer and PhD scholar in community ophthalmology. And Dr. Sovik Manna, who is also research scholar, research officer and PhD scholar in community ophthalmology. In fact, the government of India is having a goal that they will reduce the burden of blindness, and in fact will reduce to level of 0.25% by the year 2025. The current estimate is that the prevalence of blindness is 0.36%, and by 2025 we aim to reduce it to 0.25%. And National Program for Control Blindness, in fact recently in Man Ki Baat, Prime Minister of India, he has launched a special program that's cataract blindness backlog free elimination. That is one program we are looking forward that all the people who are blind due to cataract, they should be operated. It's a mission mode program, and we are targeting more than 3 crore surgeries in next 3 years. So this is a government of India initiative. But we are still looking that we will eliminate blindness. But when we talk about globally, the WHO, they are far ahead. They are not restricted to blindness. They are talking about visual impairment. That means if you can see this chart, blindness is when the visual acuity is less than 3/60. In India, nearly 5 million people are blind. But WHO is talking to a level of less than 6/12. They label visual impairment when visual acuity is less than 6/12. In India, nearly 35 million people are visually impaired. So WHO talk about eliminating blindness, not only blindness, but eliminating visual impairment due to cataract. Much broader goal actually. And beside this, in recently, as per World Vision report, the WHO, they said near vision, person who are not able to see or can't read, uh, that is also part of visual impairment. The presbyopia, common thing. Previously, it was not part of visual impairment, and now it is included as part of visual impairment. So entire thing is visual impairment, and if we go as per the figure of visual impairment globally, the number is nearly, they estimate 2 billion people. 25% of global population is visually impaired if we include less than 6/12 cutoff as well as near vision affected. We conducted national blindness survey, national blindness and visual impairment survey from 2015 to 2019. RP Center took lead, and nearly 1 lakh people were covered under this survey. And I'm really feel bad that even at this stage, cataract is the leading cause of blindness. Two-thirds of blindness is due to cataract, as well as it's also a leading cause of visual impairment in our country, which is responsible 71% of visual impairment also. You can understand. We think about that we need to control other diseases like glaucoma, diabetes, retinopathy, but even at this stage, the maximum emphasis has to go to cataract only. And, and if we cataract is one disease which is easily treatable. You just need to do a surgery here, and still you see it is a major cause of blindness and visual impairment in our country. So, how to monitor cataract services? So, there are different indicators. We are talking about the initial indicator which has been commonly used in our country, where in fact each and every district they are supposed to report about the total number of cataract surgeries conducted in our country, and that is cataract surgical rate. cataract surgical rate is just a quantitative indicator, no quality is there. That means total numbers of surgeries conducted, and when we define is, see, that's 64 lakh surgeries, 6.5 million surgeries are conducted every year in our country. So this is just a number actually. And as per definition, this cataract surgical rate is defined as number of cataract surgeries per million population per year. As I mentioned, it's a quantitative indicator. In India, the number is around 5,000 surgeries per million population per year. This is quite a big number actually if we compare with other South Asia region countries. In Bangladesh, this figure is around 1,000. In China, it is even less than 1,000 surgeries per million population, and we are doing 5,000 surgeries per million population. In Gujarat, it is surprising for you that the cataract surgical rate in Gujarat is more than 15,000 surgeries per million population per year. Very high number of surgeries are being conducted. But this indicator just give information about number of surgeries, about quality, coverage, etc. That is not given. So we use another indicator, that is cataract surgical coverage. Cataract surgical coverage means whatever the number of surgeries needed, out of which what proportion of surgeries we are actually able to do. So total number of surgeries conducted divided by total number of surgeries we required in our country. So are we doing surgeries among people who need these surgeries? That is cataract surgical coverage. In fact, this indicator can only be assessed by conducting population based surveys. This is very important, that it cannot be directly reported by any agency or any person or any district or something. I will explain, like, these are the figures which are the total all those people who need cataract surgeries. This may be the total number, and that means their best corrected visual acuity is worse than a specific threshold. Like previously, we used to take blindness as cutoff, and 3 by 60 was the indicator. And then you have a choice. You can use 6 by 60 as a cutoff, 6 by 18 as a cutoff. But if you go as per recent definition of WHO for visual impairment, then you can even take 6 by 12 as a cutoff for calculation. This. So whatever number of people, if their visual acuity is less than 6 by 12, and that is due to cataract, that is the total need for cataract surgery. And then we have to assess out of them how many are being operated. So as you can see, this figure, out of all these people, the green one include those who are bilaterally operated patient, whether having pseudophakia or aphakia. The green number is X, which is bilateral operated. Y is another number which measure people who are operated in one eye, and Z is the third group, which are not operated or blind due to cataract. So in this way we can classify. And cataract surgical coverage, then X and Y are the people. X is who are bilateral operated, Y is who are unilateral operated. So their operated number is on the numerator, and the denominator we have all operated, plus Z is the number which are bilateral blind due to cataract. So X plus Y divided by X plus Y plus Z. This is a number, and it is calculated in percentage. This is cataract surgical coverage. When we did this survey, we assessed these indicators for our country, and we are very happy to say that for a cutoff level of 3 by 60, 93.2% is the cataract surgical coverage. That directly means that 93% of people who were blind due to cataract, they were operated for cataract. 93%. That looks a very, very positive indicator. But that we are talking about blindness only when visual acuity is less than 3 by 60. If the same indicator is calculated for a cutoff of 6 by 18, these figures come down to 74%. For 6 by 12, it will be further less. So one indicator, if we take blindness as a cutoff, it looks quite good. But just remember, those people who are, say, nearly 7% people who are not operated due to cataract, they are responsible for nearly 70% of blindness. This is a huge burden of cataracts. Only 7% people are not operated, not blind people, and that is responsible for nearly 60% of blindness in country. Even with this cataract surgical coverage, this is a good indicator, but there are certain issues with this coverage. Number one is, this is also number of people operated divided number of people who are actually require cataract surgery, but that do not give about quality of cataract surgery, like whether surgery was good, whether visual outcome were good. That is not given in cataract surgical coverage. Person, even after cataract surgery, they may be blind or visually impaired after cataract surgery. That may be because of some other disease which patient is having, ocular comorbidities, like because of diabetic retinopathy, because of glaucoma, there may be some other disease. The patient may need spectacles and they are not wearing spectacles even after cataract surgery, they will remain as blind or visually impaired. So that is one group. Those who need spectacles, even them, the visual acuity can be less than 6/12, they may be visually impaired. And sometimes we have post-operative complications or even operative complication among these patients that also lead to lesser vision than 6/12. So that component is being not covered in cataract surgical coverage. And as I mentioned, we can calculate it for 6/18, 6/60, 3/60. So different threshold are there, and that may be confusing sometime for different people. And beside this, we can calculate it for person as well as for different eye level also. So these are the different issues. So that's why we identified, in fact WHO has given a latest indicator, that is effective cataract surgical coverage. And that means, have we been able to restore the sight among people who undergone cataract surgery? That's very clear. Whether cataract surgery is good enough that the person is now not visually impaired or not blind. That is this effective cataract surgical coverage. And as per WHO, this effective coverage is of sufficient quality with no visual impairment. That means the visual outcome should be better than or equal to 6/12 visual acuity. The person should be able to see clearly. He should not be visually impaired after cataract surgery. This is that indicator. And for this, it is not that we have developed this indicator. This resolution was taken in World Health Assembly 73.4 as part of the integrated people-centric eye care. And under that, the WHO, they define two specific indicators which are responsible for global progress of universal health coverage by the year 2030. And these two indicators is, one is effective cataract surgical coverage, and a similar indicators for refractive error, that is effective refractive error coverage. And it is not really linked with cataract or refractive error. In fact, these two indicators define overall health status, overall health coverage, universal health coverage for any country. So as I mentioned, this effective cataract surgical coverage is usually calculated for 50 plus age group, 50 years and above population. And we look for that whether cataract visual outcomes are of good quality or not. So as I mentioned, principle here is universal health coverage. And globally it is accepted that all the people, irrespective of their paying capacity, they should get facility for treatment, for surgery or something. They should have availability of services, they should have accessibility of services, and they should have like cost. The cost should not be a barrier in providing such services. So this is a calculation for effective cataract surgical coverage, where we have A plus B divided by C plus D plus E. The formula looks very complicated, but again, as I mentioned, it as in effect in cataract surgical coverage, in effective, A and B is separated in place of X as Y, because in A means people who are actually unilateral operated, and the visual outcome should be better than 6/12 as a quality indicators. And that means it is a met need, and patient is having vision better than or equal to 6/12 after cataract surgery. B means patient is bilateral operated for cataract, and the visual outcome in at least one eye is better than or equal to 6/12. That is also considered as met need. Whereas C and D are in relation to A and B. C means people who are operated in one eye, whether irrespective whether it is vision is better than or 6/12 or worse than 6/12. That means it acts as a denominator for A. B for D is actually people who are operated in both eyes, and here also it is not necessary that visual outcome has to be better than 6/12. It is also a denominator for B. whereas E is equivalent to Z of cataract surgical coverage, and it means all the people who need cataract surgery, who are bilateral blind due to cataract surgery. That is the unmet need. To simplify it, that if patients are operated in both eyes, some they have visual outcome better than or equal to 6/12, that is given by this green color, and some may not have visual outcome better than equal to 6/12, that is given with green with red cover up. So what we say is, another group is who are operated in one eye. Again, some have visual outcome better than or equal to 6/12, and some may not have better than equal to 6/12. And third group is the one who are not operated. So what we meant is that A means people who have visual outcome better than 6/12 after the cataract surgery. That is the group. They are operated for one eye and having visual outcome better than 6/12. B means they are bilateral operated and visual outcome are better than 6/12. So this the way we calculate this indicator. As I mentioned about C and D also, that C is representing A plus those people where visual outcome is may not be better than 6/12, and D represent B group who are bilateral operated and visual outcome may not be better than 6/12. So the calculation are maybe a bit difficult, but when we use calculation, we use computers and we use some software, and if we have collected the data related to visual acuity, it will be easier for us to actually calculate these indicators. The global target is that what is the actually requirement, what should be the achievement. So as per WHO, by the year 2030 we should have 30% point increase in this effective cataract surgical coverage. That is our target. For that we should at least know what is the current status in our country, and as per national survey we calculated the effective cataract surgical coverage. You can see, which we are saying that 93% coverage as 3/60, but when we calculated the effective cataract surgical coverage, effective component was taken, it was just 31%. That directly means a large number of patients in our country, they are operated, but their visual outcome is not as good as 6/12. The quality is an important factor in our country. In fact, that may be because they need spectacles and they're not wearing spectacles after cataract surgery. That may be because of some complications after cataract surgery. That may be operative complications, or that may be because of other disease which is affecting that person. But this is a serious issue, that we just have 31% as the effective cataract surgical coverage in our country. And as per the target, we have to increase by 30%. That means in our country we should achieve to a level of 61%. 31 plus 30 is 61% by the year 2030, and it is not an easy indicator. Probably we need to work very hard in our country to achieve this target.